Hello, I'm Dr. David Rosensweet, and you've tuned in to I Wonder Doctor Live in North America and South America, Antarctica, all around this planet and all the ships at sea. Now, if you are a ship at sea, be sure and keep your hand on the tiller while you're watching this. And I'd like to open our discussion and then answer questions. You can call in your questions and I'll respond to them live, which is a great way to do it because we can go back and forth. I can learn more about you. Call 888-502-8886. And one of the questions I've heard over decades of seeing patients, they all come down to very basics, even though there's a tremendous variety of diagnoses, a bewildering number of diagnoses. What you do about it all comes down to some basics, and today I want to review those basics with you. And I think, especially in this day and age, there's a new challenge because someone will go to the internet right away when they've got some symptom or they've heard some diagnosis that a relative has, and it is bewildering, is it not? You can get 82 jillion opinions. You can think, if I have this, I'm fine, or you think you can learn from the internet, if I have this, I'm in big trouble, or around nutrition, if I eat this, it's going to take me out. If I don't eat this, it's going to take me out. And I first encountered this in the early 1970s when I had a very vigorous interest in nutrition, and there was a PhD who was very popular at the time, Pablo Irola, and the book that someone gave me on nutrition from Pablo Irola was, Are You Confused? And it was really about, are you confused about nutrition? And why? Because you can read one opinion and then 2 minutes later you'll encounter the opposite opinion. And what in the heck do you do with all that? Well, first of all, I want to funnel it down to no matter what diagnosis you have, or no matter what illness or symptoms that you want to alleviate, it always comes down to causes. A long list of them. If we had a video of your whole life and we just were looking at an edited version of your life that just had the issues where you were not having a good time, where you're upset, where you were stressed, when we took out all the happiness, the fun, the love, the life parts of it, we'd leave behind a story, a video of how you got ill, how you developed symptoms. And the great news is no matter what that diagnosis you have, it all comes down to, can you turn the corner on that diagnosis? Can you heal? Every patient that has ever come to me, no matter what they've come to me with, their fundamental question is, yeah, can I heal this? And the answer is, you'd be astounded at what people have healed. I mean, I've worked with patients that they were in the hospital and it looked like they were going to pass away within days. And these are older patients too. And they turn the corner and they're alive and well and they're having a great life right now. And the illness is very far in their rearview mirror. And so how did they do that? Well, it all came down to addressing the causes. And I've mentioned this many times, and of course I Wonder Doctor, our videos are loaded with this. You will need to understand where your nutrition is and improve it. Get it like our ancestors were eating. They were eating whole foods that were coming from healthy soils and healthy animals, and that's what they were doing. And they didn't have any bottles, boxes, and cans. Nutrition, you have to figure out nutrition, and you got to take it step by step by step by step. Because I've never asked of a patient, hey, listen, you got to totally change your nutrition and you've got to do it within a week. No way. In fact, our bodies begin to heal, this is another basic principle, I believe, when they sense you have discovered commitment. And what commitment is, it's you promise yourself and everyone and the universe that you're going to do what it takes to get the job done. That once commitment enters your being, the purpose of illness, which is to grab your attention, to ask you what's going wrong, the purpose is alleviated. And you can start your healing from when the commitment comes in. That means if you have nutritional changes to make, you don't have to make them in a day or a week or a year or 10 years. You just have to go down the path In fact, we design programs with people that aren't stressful. That's part of the whole challenge. You shouldn't take everything on at once. You just take on one step at a time. And new to the I Wonder Doctor program, and not new to the world of healing, although relatively new, is a health coach. In iwonderdoctor.com, you'll find access to our health coach. And what do? They help you identify what's one step that you can take, and they help you take that step, as defined by your physician, your personal physician, as defined by your own knowledge of what step you need to take. Yes, health coaches make up. They're the future of medicine. Now, I'm going to take us back to, no matter what diagnosis you have, if you can turn the corner on how you eat, how you breathe, that means you breathe more, how you exercise. A lot of people are making big errors there, too little or too much. You don't want exercise to be stressful. We want it to be beneficial, leading an active life. So how you eat, how you breathe, how you exercise, and how you react or respond to the stress in your life. There's no need, nor is it possible, to eliminate all stress in your life, nor can we. In fact, human life, stress is a very important part of it. Interestingly enough, it's a big topic. It's what makes us strong and what makes us grow. It all has to do with how we react to stress. How you eat, how you breathe, how you exercise, how you react or respond to stress, and if you have any detoxification to do, because in this day and age, we've been exposed to so many toxins. If you get good at those things, and you take one project on at a time, guided by yourself, guided by your friends and family, guided by a health coach, over time, most everyone heals. It's amazing, and it's amazing what they heal from. So I want to take the whole confusing amount of information that you can encounter on the internet or even in medical textbooks and boil it down to take on those projects, and you'll be doing 90% of the healing you do. Sometimes technical help is very important. Boy, a physician or a nurse practitioner with access to many modern tools can make a world of difference to turn the corner on the big stuff. Medications, surgery, chemotherapy, radiation. There's all kinds of tools there. And yes, those sound intense, but I'm a holistic doc, and I believe that you use the right tool at the right time. So technical can be a major part of it, or a significant part of it, or it doesn't have to be. But the main thing, you're going to do 90% of it just by getting really skilled at what you eat, what you breathe, that you do breathe sufficiently. Most people are under breathing. How you exercise, and if you have any detoxification to do, and the elephant in most people's room is, can you acquire the information, tools, and support so that stress is occurring, but you're responding to it in a very creative way, that you don't trigger the fight or flight biology, which is what is dismantling so many of us. As I was talking to my sister the other night, as we were looking at, well, what are our current health challenges? Well, oh my goodness, I'm so grateful for all the success that I've had with my own health and my own life. It's outrageous. I've been devoted to this, my own healing, for a long time. But even at this day, and I was talking to my daughter about it as well at lunch, my hurdle, my project is around my mind, the kind of stories that I can come out of nowhere where I worry, and I spend time worrying, and thus triggering the internal biology of the fight or flight. So that's my project. That's my moment-to-moment project. Hey, the deeper you get into it, the more interesting it is. And most important, you get the rewards of, you get to join life deeper and in more interesting, with more fun and more love than you ever have. Because that's what awaits us all, is life. It's a fantastic journey, as so many of you know. So don't be confused about it. Take on the basics. And one other thing I want to address within the basics is, if you look up nutrition, you get 50 different opinions in there. And why? because they're all correct. Some people, if they eat animal food, they're going to get ill. And at the other end of the spectrum, there's some people, if they become vegetarians, they're going to get ill. And there's everything in between. Some people can't eat wheat, some people can't eat wheat, some people can't eat dairy, da-da-da-da. There's 82 zillion things out there. Why is there 82 zillion things out there? Because for each one of us, there's an individuality that we've got to find our way into what do I like to eat and what's good for me and what really helps my health. Some people, they have to find their way into all people have to find their way into the optimal diet for themselves. So that's where it gets confusing out there. And that's why you get, if I drink coffee, it's going to give me ulcers and everything else, and it's going to deplete my hormones. Someone else will say, if you don't drink coffee, you could get dementia from it. It's that wild out there because there's such individuality. So what is the job? You learn over time what suits you as an individual. And once you get that principle to individualize for yourself, there's all kinds of ways to do that, and there's all kinds of clues to do it, and anywhere from a health coach to a highly trained nutritionist or physician, holistic physician or nurse practitioner can help you with this. So that was one final principle. You don't have to be bewildered about it. Yes, you're going to hear passionate opinions because they were right for that person or that group of people, and then you'll hear the others. You have to find your way into your own individual optimal diet, optimal exercise program. Everyone's got to find their way into improving how we respond to stress. Some people have to detoxify. That's the whole story. It's not complicated. It comes down to what can you implement? Ho, 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 ho. Yes, all kinds of ideas. What can you implement? And that's why in I Wonder Doctor, we have a fundamental principle. We want to give you one thing, take on one project that we identify as a priority. For some people, they have an ulcer and they have to stop eating spicy food. So maybe that's the priority that person takes on. And whether they're doing this alone or with family and friends to encourage them, or with a group, a healing group to encourage you, or whether you have a health coach, those people, even your own self, for sure your own self, helps you until you get success at doing that one thing. And that's very rewarding because you know it's good for you. And then the next thing, then you take on the next thing. And by a couple years, you've taken on 10 things. You've made 10 improvements. Wow. It gets really interesting at that point because you just keep getting healthier and healthier and healthier. So, bewildering? No. Not once. The more you learn, the more basic it gets. And so I'll return to this topic many times because it's such a fascinating one. And what does it do? The power, the choices, the projects, they're yours. Ultimately, it's your day-to-day, moment-to-moment, that is going to determine whether you heal an illness or you don't, whether you roll it back or you don't. And yeah, fascinating. I've loved it for so long. I'm just so into it all, but you can be too, because you can do this. And again, one final thing in this regard, I have been astounded by what people have healed. Stuff that's been troublesome, and they eventually got their arms around it, and now they don't think about it anymore. To the very worst of the worst of the worst, where I as a physician thought they were going to pass away within days. No. They're alive. I'm thinking, I see the people. I know who I'm talking about. They're alive, functioning, and have turned the corner years ago. So you can do it. So we've had questions come in, and I'd like to address them. And of course, you can call us and have your questions answered live at 888-502-8886. So here's a question from Arthur. I've recently started to get very dizzy when I stand up. I don't know if this is something I should be concerned about. I Googled it, but the answers are so vague. I could be suffering from 25 different things. What might be causing this? Well, Arthur, one of the reasons I chose to answer your question is a version of this is what so many people confront. They were feeling okay, fine, healthy even, and then out of the blue, up comes a symptom. And then you look on the internet and you go, oh my God, I could, and this is, we used to call this medical student's disease in medical school. Like one day I'd be reading about thyroid cancer, and the next morning I'd wake up and I'd feel my throat, and I thought, oh my God, maybe it's thyroid cancer. The next day I'd be reading about gout, and that afternoon I'd go, God, there's a pain in my toe, I think I've got gout. Medical student's disease. Whatever you're reading about, whatever you're focusing on, you think you have. A little bit of diversion there. But here's one thing. When you have something like dizziness and it's new to you, there comes a moment where you want to seek out a trained health professional, a medical doctor or a nurse practitioner. Because most of the time these symptoms come and go. There's reasons why they come and go, but they come for a reason. But there's so many times I say to myself when someone approaches me with new symptoms, well, I don't know what this is, but what could I be missing as a medical doctor that I wouldn't want to miss, that could be really troublesome? And this was at the foundation of medical doctor and nurse practitioner training. So if you were to come to me or any physician, they would go, okay, let's do the basics and see if there is anything that's popping out as being problematic. And so many people, they go to medical doctors or nurse practitioners and they walk out of the office and the health provider has been scratching their heads. Well, I don't really know, and we can run some tests, and the tests aren't very conclusive. Well, here's what I promise you. 2 great things have happened during that visit. Number one is the physician or nurse practitioner is scratching their head. That's what you want them to do. They are highly trained to pick up the rough stuff. And between their own history and physical exam and the tests that they might choose, they're going to see rough stuff. So if they're going, well, I don't really know, don't be disappointed. Go out and celebrate. That's what you want. And once someone has ruled out anything rough in there, that gives you a freedom to try and sort out what is going on. Sometimes the symptoms that you're developing, they're the beginning of a process that is going to get more intense. And I like to intercept processes of having difficulties, physical difficulties, as early on as possible. But whenever you intercept it, there's a moment of truth where you should go to a health professional and at least get the relief of them saying, gee, I don't know, that's what you want. They know how to find the rough stuff. That's number one, Arthur. And that's what I'd say for you is, if you have never been dizzy, and all of a sudden you're getting dizzy, I wouldn't say get worried about it. I'd say do the right thing. Give yourself, your soul, your heart, your being, your mind, the privilege of taking the right next step, which could be, well, let me go get this checked out. Here's another thing. A lot of times, all these symptoms, dizziness, whatever, there's minor things that are at the cause of it. And when things are subtle and minor, if you go into the internet, you're going to see 25 possibilities just like you did. As things progress, it gets easier to diagnose, and if you're dealing with a health professional, it's much easier for them, because how they've been trained. This is what they've been doing. Their professional careers. It's much easier for them than it is for you. Now, let's talk about dizziness or any symptom. Any of you who have any symptom, dizziness, sore toe, vision changing, whatever it is, there's a reason that this is happening. And one of the core reasons is your physical body is starting to give you strong signals that, what? Something's not right here. And so what you want to do is honor and respect that. And your physical body, so to speak, wants you to ask the question, what is going on here? and it wants you to come up with the right answer. And it's going to continue to produce that symptom because those signals are loud enough to catch people's attention. Like all you have to do is have an economic crash, a relationship crash, or physical symptoms to catch anyone's attention. And catching your attention should lead to the same question. What's going on here? And our physical bodies want the right answer. They're not going to accept something like dizziness is as simple as a meat deficiency or something, or a Xanax deficiency, or whatever, or a high blood pressure medicine deficiency. And it could be high blood pressure, by the way. It could be low blood pressure. It could be a lot of things. It wants the real answer. And the real answer ultimately is going to come down to exactly what I opened with. There will have been some variations in the optimal nutrition from you, some toxic exposures, some too little or too much exercise, or the long-term consequences of exaggerated physical response, fight or flight response to stress. It's all going to come down to those causes. And so that's your project. And when those symptoms start to disappear is when your being, so to speak, gets it, that you're committed to address what was that cause. And also that you're doing the right thing. And sometimes the right thing with dizziness is go in and get an evaluation. That could be an elevated blood pressure. It could be too low blood pressure. There could be something wrong in your nutritional plan to the point where it's giving you anemia or something like that. There are 25. In fact, there's probably 250 or 2,500 different possible causes. That's how complex the physical body is. But yeah, with that kind of signal, start with ruling out the stuff that could be problematic now. For example, even if you have high blood pressure, you eventually want to get at the causes that got you there. But you might benefit from a blood pressure lowering medication to bring you into reasonable levels while you sort out the causes. A lot of times people do that and they embark upon the trail of improving their nutrition, detoxifying, improving how they exercise, and the need for blood pressure medication in many disappears. But the first step could be that for that person who had dizziness because of blood pressure, that they need that blood pressure medication to buy them time and space to do the ultimate healing. Or sometimes you take it for the rest of your life. It doesn't matter. You bring yourself back into the safety zone. So to wrap it, Arthur, the steps I'd recommend is get it evaluated. Dizziness that you haven't had before in your life, at least go through the basics with someone, and they'll either tell you, hey, here's what you've got to address, and here's how you got to address it from our perspective. Or if they say, gee, I don't know, that's great. Go after the nutrition, detoxification, exercise, and stresses in life. We've recently had a patient that she was working in a tremendously stressful job because there was some illegality going on, and she was a very moral person, and she had to make a change in this work situation because it was stressing her so much, but she didn't have in that moment the foresight or the strength or the faith that she could make that change. And then once she did, it started her off on a path to healing. So sometimes it's something in your life, a lot of times it is, that really matters. Dizziness, like all symptoms, a doorway to, hey, something significant is going on in your body, in your life, and there's causes. And sometimes you need some immediate help with some medications or some surgery, and sometimes you don't. Sometimes some significant life changes, the stress diminishes, and you feel better, and the dizziness goes away. So everything has causes, sort them out. Now, I have time for one more question today, and this is from Rhonda. For the past 5 years, I've been getting recurring urinary tract infections. I'm tired of taking antibiotics. What can I do to stop these from occurring so frequently? Well, Rhonda, this is one of those situations where the ideal thing is if I can talk to someone and ask you a few more questions. I have to make guesses about how old you are, because recurrent urinary tract infections in women, and in young women, it usually relates to intercourse and vaginal health. And sometimes it's a stressful relationship that's irritating the tube that runs from the bladder to the vagina, through which women pee, actually ends in the vagina. And it is really subject to irritation during intercourse, and also vaginal infections. So that's a realm that has to be sorted out with a woman and a gynecologist, and sometimes, and very often, there's some stresses in the relationship that have to be ironed out. So the big topic, I'm not going to go into that, but I'm going to make a guess that you're in menopausal age. And one of the things that happens when you lose your female hormones, and this is a guess because they don't actually know how old you are, the health of the vagina changes. And that same location where the urethra empties into the vagina gets, the health of it changes, and it gets easy to irritate it. It gets inflamed almost all on its own. You get something called change of the vaginal lining cells, vaginal atrophy, and it's a setup for recurrent urinary tract infections. So I'm going to guess that that's the age group you're in, and I'd suggest, if that's so, that you seek out someone who is really knowledgeable about menopause and hormones and the restoration of healthy and important levels of female hormones. Now I'm making a wild guess, Rhonda. If that is correct, go to www.menopausemethod.com, and you'll get some clues and you'll get some help about someone who's expert in this field. And there's many, many other causes of recurrent urinary tract infections, but I picked out a couple of the most common ones because a vaginal yeast infection can do it too. It can irritate that urethral meatus and lead to recurrent infections just from that. So I've only touched upon 3 of the more common causes. There's many possible causes, but there's always causes, just like with Arthur and his dizziness. With anything, there's causes there. And Rhonda, you can find them, you can sort it out. And a good stop, of course, is with a health professional to see if they have clues, and someone who can do a gynecologic exam to see about the health of your vagina. Well, one more time I'd like to mention that we now have health coaches available on I Wonder Doctor to help you take the step-by-step process to help you in your healing journey. And it's been a pleasure to be with you. I'm Dr. David Rosensweet. I love to answer your questions. Call us every Monday at every Thursday at 1 o'clock. Call 888-502-8886, or go to I Wonder Doctor and send us an email with your questions. The more detail you can provide me in your emailed questions, the better it is. The best is the call in. Good to be with you.